The World Health Organization has declared that the novel coronavirus, COVID-19, is in fact a pandemic now. It is an epidemic in multiple countries, and they finally acknowledged that. And in a time like this, what you want is to have government officials who are competent and honest with you. And we, unfortunately, while we have many resources at our disposal as a country, that is not a resource that we have. And so I'll take you back to less than 2 weeks ago when Donald Trump said, you have 15 people in the US with COVID-19, and the 15 within a couple of days is going to be down to close to zero. Remember when he was hyper-focused on that 15 number, even though at that point the number was more like 60? And you had Larry Kudlow, director of the National Economic Council, saying, we have contained this. I won't say it's airtight, but it's pretty close to airtight. Well, when it comes to germs, it turns out that you probably want it to be airtight, because despite the fact that they tried to gaslight people into believing that we are totally prepared, we're taking this seriously, and we're gonna be just fine, the number's gonna be zero soon, the number is very much not zero right now. Let's bring up a map. We're gonna show you the spread of COVID-19 across the US so far. Yeah, so you're seeing well over 1,000 cases now. Hundreds in New York, or close to hundreds in New York, close to hundreds in California, close to hundreds in Washington there. We have 1,015 infections in 38 states and Washington, DC. 31 patients with the virus have now died. And so that is how it is spread across the country. How it is spread over time, let's take a look at this. New COVID-19 cases announced in the US each day, and you can see that it has been rising, particularly in the last couple of days. And what I want people to understand about this is the context that we exist in. And what we have found in looking at the spread of this particular infection in multiple different countries is that the rise in numbers has followed a very similar curve in all of these countries. So let's show you this. It is the rise of infections in a lot of different countries: Iran, Italy, US, Spain, France, Germany, Switzerland. You get the idea, a whole bunch of countries. Now there have been some, like you can see, Japan, Singapore, Hong Kong, that had very quick responses that shut down public gatherings and things like that, as well as, it's complicated. A lot of different things contributed to the fact that they have not had the precipitous rise in infections, something like a 33% daily increase in infections. But most other countries have followed that growth pattern, and the US is right smack dab in the middle of it. And so hypothetically, it is possible that we will see maximum cases within a few days or a week, similar to some of these other countries. Italy went from 1,000 cases to 10,000 cases very quickly, and the US so far has been following the Italy curve. And so it's not impossible to think that here in the US, we could see 10 times as many reported cases within a week or less. And the reason that I feel it is so important to let people know about what we're experiencing, what other countries are experiencing, is because for many people who have been relying on cable news, they have not been getting accurate information. They have been being lied to actively as part of a campaign to protect Donald Trump from the political fallout of this disease, even if it means taking away people's ability to know what they need to do to avoid contracting this illness. So let's take a look at how Fox News has been covering this. Sean Hannity had the hysteria of the media using it as a political weapon. You have another Fox host, Trish Regan, partisan manipulation. They refuse to acknowledge the left's partisan virus coverage. You know, when they, in a partisan way, list the numbers rather than hiding it, as the Trump administration has been attempting to do. And then you have Laura Ingraham, who she doesn't even like pretend like some of the others are that she's taking this seriously. There, Trump holding nation together during outbreak. You know what that video is? That's from Benghazi back in 2012. Because what she spent her broadcast doing last night was talking about, okay, things aren't looking great with Trump, but it would be worse if Hillary had won. It's 2020, and she's talking about what if Hillary had won 4 years ago? It'd be worse. It'd be worse if it was Joe Biden. It'd be worse if Bernie Sanders. Why? Because I want to believe it, and because I desperately want you to support Donald Trump. And here's the thing, as I have said ad nauseum from the very beginning of this, Donald Trump and the Republican Party is not responsible for the fact that COVID-19 exists. And they're not responsible for the fact that some people have gotten infected in the United States. That was a certainty from the very beginning. It was going to happen. Even the countries on that chart we showed you that have had the strongest response have had some infections. Japan has had some. despite the fact that they responded very forcefully and quickly to the development of coronavirus. It still has affected some of them. But what he is responsible for is what he does and what he doesn't do. And we can look at some of these things and have a problem with it. So when we look at the testing rates per capita, the US has conducted, as far as we know, 5 tests per million people. South Korea has done nearly 4,000. China, nearly 3,000. Italy, who's been hit very hard, nearly 1,000. Some countries that have had relatively low rates of infection have 100 times the tests that we have. And the issue is that they could have been serious in terms of getting these kits out to everyone, but they haven't taken it seriously. There's a story out of Washington right now about a doctor who was worried in the initial international development of COVID-19, and she wanted to see if people who were having flu-like symptoms in Washington had COVID-19. And so, despite the fact that she was not supposed to, she started testing for it before anyone else did, and she found infections there. And when she told the CDC about this, do you know what they did? They told her to stop testing because they didn't take it seriously, or they were told to hide the numbers because remember, from the very beginning, Donald Trump has been far more concerned about the appearance of infections than the actual development of them, including leaving people on cruise ships to possibly sicken other people rather than bring them to the United States for treatment if that makes it look like the numbers have temporarily gone up. And to give you an idea of how lacking in a serious response he is, The Week is responding that Trump reportedly isn't gonna meet with Pelosi on a coronavirus bill because he's mad at her. They're not on speaking terms, apparently. And so he's sending Steve Mnuchin when the president should be as serious about this as possible. He doesn't like Nancy Pelosi, so maybe he won't deal with her. Maybe he won't want to give her a win in responding to this. And I just read this right before we went live. The White House has ordered federal health officials to treat top-level coronavirus meetings as classified, restricting information. From reporters, certainly, but also from other people in government and in state governments that desperately need this information. Because again, it's about controlling the information, not about controlling the spread of this illness. And we've already hit 1,000. We've doubled in just a couple of days. What's gonna happen in the next few days? God, I hope that despite their incompetence, despite the fact that they don't seem to really care about this, I hope that it caps out at 1,019. But I fear that with this approach, that is not gonna be the case. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.